Mini medical safari camps are a variant of the famous medical safari camps of the year 2018-2019, one amongst the products offered by the Beyond Zero campaign of the First Lady of Kenya, Her Excellency Margaret Kenyatta.
Starting from Narok, going to Kisumu, West Pokot, and many other places we've been able to provide these services to various people.
Kienda soko, unaenda na hiyo kiondo.
Then, about 25 health service providers will partner to offer health-related solutions to vulnerable community members.
Nilisikia kwa redio ikitangazwa, nikasema hata mimi nikuje nikuwe mmoja yao.
Niliangalia kwa TV yangu, nikaoneshwa mnakuja tarehe 12.
Kuna mama tulikutana na yeye kwa center yetu kule, na akaniambia kuna huu uchunguzi unafanywa wa mama mahali hapa.
The camps are set up on rotational basis from one county to another. Sadly, after the explosion of COVID-19 around the globe, the momentum slowed down, and in 2020, only one such camp was reorganized and set up. It was for Nairobi County. As of necessity, the product was then restructured to fall in line with the COVID-19 protocols, and in February 2021, the first mini medical safari camp was set up at Timaflow Flower Farm in Timau, Laikipia County. In the dawn of Monday, the 22nd and 3rd week of March 2021, the second and third mini medical safari camp was set for Kiambu County. The First Lady's press team had stepped out, their mission to document the health services that would be offered during the two camp sessions. Their first stop was the Farlyndum estate in Tigoni Township.
Tuko na majani chai, vile tuko na kahawa, na tuko na nyumba vile. So mimi ninasimamia maslahi ya wafanyikazi wakifanya kazi ya kuvuna majani na vile
A sweep look around the camp reveals the number and type of health services provided. The 5 in total: the Triage, the AIDS Health Foundation, AHF, the Vision, Spring and City Eye Hospital tents, all set adjacent to one another. The Triage and the General Consultation tents make up the county's health service provision team for the camp. Nurses and clinicians from the Tigoni Level 4 Hospital, all well equipped with medical solutions ranging from general health related information to laboratory services, are ready to offer on-the-spot treatments and referrals as per need.
Basically, we are in the triage station. This is like the registration where we are taking the client details, the name we capture, we take the vital signs, temperature, and the blood pressure.
Being the first point of contact between the recipient and service providers, it by default then becomes our first point of our documentation too.
108.
After triaging, the patients are flowing to be tested for blood sugar levels and cholesterol levels. Then after that, now we can also forward them to the right clinicians in case there is any complications.
The fourth tent, the Beth Mugo Cancer Foundation, is set in the opposite end of the trio, while the tent that is for general consultation stands in the middle of the camp. The arrangement suits well, leaving spaces on both ends to allow for easy in-out cross movements. We step out of the triage and move to the adjacent tent, AIDS Health Foundation tent, streaming with persons seeking the said services.
I'm here in Tigoni, partnering with the Beyond Zero campaign to support HIV care and treatment services in 3 aspects. That is HIV testing and offering HIV prevention messages and also doing a lot of advocacy when it comes to HIV care and treatment.
Kuhusu mipira, condoms, ndio? Ama tunaongelelea EFC Leopards? Hapana. Hapana. Sasa nimpatie mpaka bona. Sawa kabisa. So unaweza ongezea ama mnamaliza hapa kwanza? Ngoja tumalize kwanza. Mtakuja. Mimi niko pale. Sawa. Sawa.
Next, we move to the eye tent. Vision Spring have partnered with the City Eye Clinic to offer said services. We found persons with varying eye concerns lined up to be attended. Elizabeth Omai, the community eyesight remedy came from the free eye services that were offered her at the community she lives.
Mimi naona kule nzuri sana, tunasema asante kwa nyinyi. Nasikia Margaret Kenyatta.
Ni shida inakujanga na miaka hiyo, ukipata miwani ya kusoma na maisha inaendelea.
We have noticed that a lot of people have issues with reading, picking the T becomes a problem, so we're grateful to Beyond Zero for helping us offer these services to the T estate. The productivity is going to improve.
Down with the eye, we move across the camp to the Beth Mugo Cancer Foundation tent, where cancer awareness creation and screening for both men and women other services are at hand.
For breast cancer, we're starting from 20 years and above, and from cervical cancer, we're also starting at 25 years.
Cancer is a disease that proves costly and hard to treat when not detected at its early stages.
We mobilize for enhanced access to breast, cervical and prostate cancer screening so as to provide these services to the people.
From the large crowd of persons at the tent, cancer seems no doubt a major concern to many.
Tunaangalia whether ni cancer or not. Unajua it can be affected by many things. Inaweza kuaffectiwa na trauma, si ndio? Hata hapa tukikupima, tukiona nini hiyo PSA level imepanda. With all that, si mnajua hizi dawa za watu wanapewa za chemotherapy.
Kidole yote ile unanipatia tutatoa damu. Yes. Tushatoa damu tutaweka. Hapo umeelewa vile tunasema. Hiyo damu inatutosha. Tunahitaji mingi kutoka kwako. Tuongojee majibu sasa for at least 10 minutes. Karibu.
So any woman that we find here who has precancer lesion of the cervix, we are going to give the treatment. For any that we are not able to treat, we are going to refer them and to follow them up to make sure that they fully get the treatment that they require and they're fully restored back to health.
Before winding the day, we checked in at the general consultation tent.
I'm a clinical officer, currently working at Tigoni Level 4 Hospital. Today, I've come here from Tigoni to partner with Beyond Zero to give curative, rehabilitative.
About 100 farm workers alongside their spouses as well as neighboring community members were attended to at the camp.
Unaweza anzia ile service ya pale alafu utakujia pitia hapa kwa sababu ya issue of privacy ya.
With that, the day closed and the press team retreated to take a momentary reflection and review of the day's events. After one day, it was time to step back again into Kiambu County, our destination this time round, the Thika cloth mill factory located in Thika town. Determined not to miss out on the opportunity to capture the night shift factory staff streaming in, we drove along the Thika superhighway, the chilly morning breeze hitting onto our faces as we enjoyed an ecstatic view of the sun rising and dawning the horizon. Soon enough, the night shift workers in groups were already streaming into the camp, and within no time,
Kwanza kabisa nafanya kazi pamoja na Thika Cloth Mill ambayo inatengeneza uzi na manguo.
We're ready, all in good time for our mission, and the ground got busy. We observed and noticed the various measures put in place by the factory management to ensure the success of the venture.
Tuvae barakoa, hiyo pia ni jinsi ya kuonyesha upendo, tusiambukizane ugonjwa wa COVID-19.
Tuko na sehemu nyingi sana za kunawa mikono. Wale ambao wamefika saizi, tunawe mikono yetu kutumia sabuni na vizuizi ambazo vimewekwa tafadhali.
With their quest to offer similar health-related services as they did in Tigoni, and knowing too well that the night shift workers will be but longing to retreat to their respective homes for a rest break, unrelenting service providers were already stationed in their tents, adequately equipped with supplies to run for 3 consecutive days.
Baada ya kuelimishwa, utaandikisha jina lako, kuna fomu hapo utajaza. Baada ya kujaza, utaingia kule ndani ukapimwe na uangaliwe.
At least you can be able to know your status venye uko, na kama kuna shida unajiangalia mwili yako, then unaenda unaangalia daktari.
In warming up, we bumped onto the industrial relations officer.
Thank you. We have 700 employees, including our head office. We have arranged them to be checked within the next 3 days, from today 24th up to 26th. And we are running 3 shifts. So in every day, we are going to we are going to allow about 30 persons per hour, and they have come out in large numbers to be tested.
The ground got busier. As with Tigoni, the Beth Mugo Cancer Foundation team remained up a bit at their station, educating on cancer and even screening those who wish to undertake the SEM.
Tumeweza kujulishwa kuhusu kupimwa na kujua prostate cancer kwa mapema, na alafu tumeelezewa mambo kuhusu lishe na mambo kuhusu lifestyle yetu venye tutapandiliza ili kuepukana na ama kupunguza chances za kupata prostate cancer.
The female staff too were well attended with this cancer station.
Umeandangaje? Ushasikia pengine uko nje mmeambiwa. Mmeambiwa nini? Mimi nataka kusikia vile mmeambiwa. In case tukuje tupate hapa, si tumesema 10 to 15 years, yeah, that period zinaanza kumwagika, zinatoka. So ni kama vile umechomeka mkono. Ukichomeka mkono siku na ngozi inatoka.
Haya, mami karibu. Sasa tutatoa viatu. Ukuje ukalie hapa, alafu ndio ulale, alafu ndio niweze kuona vizuri. Sasa tutatoa
have been tested for breast cancer and cervical cancer, of which the breast cancer have been taught how to do self-examination, and vaginal cancer, the doctor has examined me and I'm good.
We moved out and crossed over the camp onto the eye service provider's tent about 10 meters off, and here too, the service providers were upbeat.
We have a diabetic clinic, we have a glaucoma clinic. The diabetic clinic involves the retina clinic where people have retina issues. We also do cataract surgery, we do comprehensive eye checkup.
Nimekuja hapa leo kuangaliliwa, nimepimwa pressure pale, tena saa hii naenda kuangaliliwa macho, na nitaendelea nione vingine venye tutapimwa. Nashukuru.
was while here that we learned of the amazing cordial interrelation amongst the various service providers.
We have been working with CTI, who's an implementing partner, for doing cataract surgeries and also giving of the eye drops.
We've gotten cataracts, but not as many as what we got in Tigoni. A big number of people have allergies. We also provide glasses.
We tracked at the glass recipients of their workstation in True. That was on-spot application and use of the acquired eyeglasses. Prior, some workers had strained in threading the tiny needle holes, identifying defects and even reading the factory records. With all medical safari camp setups, the respective county health governments send over their medical personnel for general consultation and referral. In this camp, their tent stands next to the eye services.
Kwa majina naitwa Thika kutoka Thika Hospital. Katika hii tent yangu nachukua general information ya mgonjwa ili nijue shida zenye uko nazo, magonjwa zenye uko nazo, na ninawapea advice.
Tungeenda hospitali pia ingekuwa inatugharimu. Tunapongeza sana hiyo mradi na iendelee.
Some of the problems that I have come across in this place is respiratory problems and gastritis. Most of these problems could be caused by especially the respiratory problems, since Thika is an industrial area.
Finally, we pulled out and docked at the AIDS Health Foundation, the AHF tent. We spotted a number of female community health volunteers and male champions who are here to support the various on-site service providers. We talked to one of them.
Nimeifanya miaka mingi ili niweze, hata kama ni ya kuvolunteer, ili niweze kusaidia kijiji yetu. Hii ugonjwa ilitambaa sana kasika watu wengi, na sio ugonjwa ya HIV. Magonjwa ni mingi, hata ya kansa.
Nimezunguka kila pahali yote mpaka nijue hali yangu venye niko, ni kama niko sawa ama niko na ukimwi, nimeangalia niko sawa.
As the 3-day period was nearing its close, the factory management team took time to tour the camp to see firsthand for themselves the health operations set in place.
So they pass through here, they're registered, they're screened. Okay. I think you should also pass through.
And to make sure that they go and get the help, because now they know the problem. Thika Cloth Mills, our 700 workers and their spouses, we cannot show our appreciation more to Beyond Zero. Thank you, Margaret Kenyatta, for having such a beautiful vision where you can see that we have benefited so much, our workers have benefited so much.
Shortly after, the factory management took the Beyond Zero team led by Madam Angela Langat for a brief guided tour. The 3-day event then after ran successfully for one more day to its final end.
Kama wafanyikazi, tunashukuru Beyond Zero kwa kazi ambao wamefanya na shati yao. Nashukuru sana.